Has your doctor prescribed prednisone for gout? Is it working? And if so, how fast should it work? These are questions you might have about prednisone as a treatment for gout. I'm Dr. Megan, your prednisone pharmacist, and I'm here to answer those questions for you. This video was triggered by a prednisone warrior who said, I just had a gout attack. The doctor prescribed one pill a day for a week. It seems wrong and it doesn't seem to be working. Is it going to work for everybody? And how much should we be taking? So let's first start talking about what is gout. So gout is an inflammatory condition that can make your joints swell, get red, hot, and painful. The most common joint is the bottom of the big toe right there. It could be any other joint, could be hand, wrists, shoulders, knees, but the most common is the big toe. And there's different occasions of when you might use prednisone for gout. You might use it your first time you get gout. You might use it when you have a relapse, when it comes back. Or you might be like me and have a condition called pseudo-gout, which is calcium pyrophosphate deposition disease or chondrocalcinosis. Most of you don't need to worry about that. It's pretty rare and it's usually in really old people. What are typical doses of prednisone for gout? The general dose is 40 milligrams a day until the flare resolves. So you would take either 2 20 milligram tablets or 4 10 milligram tablets. You could even do 8 5 milligram tablets. I wouldn't do that. You don't need to take that many, but you take them all at once the second you get that prescription, and you do that until the flare resolves. So until your pain is going away. Generally, that means 5 to 7 days of treatment. The most important thing to know is that the sooner you take it, the better. If you start taking treatment the moment you start having symptoms, you'll probably need to take less drug over time. Start as soon as you possibly can. This information came from the up-to-date online medical information database. It says 5 to 7 days of treatment if started within 12 to 36 hours of symptom onset. So then you take it during that flare while you're having that terrible pain, and then it's important to taper it. Taper means to slowly drop the dose over time. So if you started at 40 milligrams, then you might go to 30, then 20, then 10, then 5, and then off. And they want you to do that over 7 to 10 days if it's your first time. If you're getting frequent relapses, you'd want to taper it over a longer period of time, such as 14 to 21 days. So 2 to 3 weeks after your flare stops, you'd want to slowly go off because it might come back. If you suddenly stop taking the prednisone, you have a more likely chance that the flare comes back soon. I saw somebody talking about how he only takes it for 1 to 3 days, and then he has to do that multiple times a month. That's not what we want. We want you to take it for 1 to 3 days and then to slowly taper off so that it's not coming back multiple times a month. That's terrible. So if you were to take it, when do you get symptom relief? How fast does prednisone work for gout? One study, a scientific study, showed that 43% of people who took 30 milligrams had improvement in pain after 48 hours. So about half of the people at about 2 days had pain relief. Another dose of 60 milligrams showed 52% of people at 2 days. So somewhere around half the people get pain relief at around 2 days. Another source, the US Pharmacist, said symptom improvement should occur in 2 to 5 days. So when my first person who was asking me about this said it doesn't seem to be working, well, that's possible in about half of people that it might not work. Who knows? But other people who commented on how prednisone is working for their gouty arthritis, I'm going to just read their comments because they're fascinating. These are clearly in people for whom it worked. So one person said, I get 85% relief after 1 to 3 days. Awesome. Another one said, thank you, prednisone. You are my best friend. Within 3 hours, I could walk with a limp and little pain. By morning, I could wear a shoe on my foot. The swelling was almost completely gone. So that's awesome. Like 3 hours to a day, the swelling's down. Another person said, this drug is amazing. I don't believe in miracle drugs, but this is pretty dang close. After 8 hours of taking my first dose, 80 to 90% of the pain is gone. Whew. That's awesome. Another person said, the results have been amazing. I took my first dose of 4 tablets and the pain subsided within less than 2 hours to the level that I could actually walk. We're getting 1 to 3 days to 2 hours here. And finally, this person said, I'm so grateful for the doctors. They prescribed me prednisone. After 2 hours of taking it, my ankle subsided. I went to bed, woke up feeling like $1,000,000. And then finally, prednisone works within hours. So for some people, it's within 2 hours to 2 days. For other people, it might not work at all. And how is it working? Prednisone is working because it's an anti-inflammatory. It's like the ultimate anti-inflammatory, and it's working by decreasing the inflammation, the swelling, the redness, the pain. All of those things are just kind of being turned off because it's shutting down the inflammation pathways, which is amazing, unless it doesn't work or it's causing lots of side effects. And let me tell you some side effects people experienced who took it for gout. One person said, I got hand cramps, body cramps, blurred vision, runny nose, insomnia, and I just feel bad. Another person said, I just wanted you to know that I only take the 60 milligrams when I have to. It does a number on my entire system. But with all that said, none of the side effects come close to the pain from my arthritis. None. So while prednisone can definitely cause side effects, in this case, this person said it is worth it because the pain from the gout arthritis is just so horrible that any of those side effects are worth it to him. Another person said it sends sugar readings high for a day or perhaps two. And other people have taken prednisone for many other conditions and have suffered up to 150 side effects and have said, I cannot believe my doctor prescribed this. This thing is the worst thing ever. No one should be allowed to take it. So you can hear both ends of the spectrum. Some people think the side effects are so terrible, and other people think prednisone is a complete miracle. And it is both. It is. It depends on your situation and your personal side effect profile. These are the side effects I personally experienced. Everything from hair loss to insomnia to moon face. It can be horrible. I had to take it on for 8 to 9 months though. And most people who take it for gout do not have to take it that long. So hopefully you don't get the big moon face and weight gain and all of those horrible things. If prednisone isn't working for your gout, what are some alternatives that you could try? So some of them are available right there in your medicine cabinet, such as ibuprofen, naproxen, and indomethacin. Isn't necessarily in your medicine cabinet, but they're over-the-counter NSAIDs, non-steroidal anti-inflammatory drugs. Again, the most important thing is to take it as soon as you possibly can. The moment you start feeling symptoms, to start getting that anti-inflammatory in there to stop the progression. Because what's happening is it's kind of like a cascade or a ball rolling down a hill, picking up inflammation as it goes. And if we can just stop that immediately, the sooner you stop it, the less a cascade of problems you're going to have to deal with. The problem with things like ibuprofen, naproxen, Colchicine, and indomethacin is that people who have kidney or liver disease or bleeding problems, it's just not very safe for them. Another option is colchicine, and colchicine is a super old drug that was recently rebranded and became more expensive, but it works quite well. The only problem is it can cause stomach upset, such as diarrhea, nausea, vomiting, and stomach pain. I've personally been taking colchicine for almost 6 months now because, again, I have pseudo gout, I have joint issues, and it really works well. Definitely did cause stomach upset, and sometimes I have to take 2 a day, but generally just 1 a day. And that can be a pretty common thing in people who have gout that comes back, that you take just a low dose of colchicine to prevent issues going forward. And it's something that I've had to do and many others, and it's okay. It's not particularly harmful to be on long term. There are a few rare side effects to be aware of, but again, they're rare. And one thing you can do is that colchicine is obviously interfering with your gut. According to the Natural Medicines database, colchicine might reduce the absorption of vitamin B12 and increase the risk of deficiency. So B12 is vital for your body, whether it's for your nerves or for your blood. And if you are going to be taking colchicine longer term, I definitely recommend taking vitamin B12 as well to decrease your risk for anemia and other complications you might have. And how does it do that? Colchicine is disrupting the normal intestinal mucosal function, leading to malabsorption of several nutrients, including vitamin B12. So definitely consider taking B12 along with colchicine if that's what you have to take instead. And if you are the type of person who's had not just one, but more than one episode of gout, your doctor might be saying, okay, we need to get you on something to prevent it. The ultimate goal is to get the uric acid levels down. Why do we care about uric acid? Because the urate or the uric acid crystals are depositing inside the joint. And we need to get the urate levels down. And how can we possibly do that? So there are prescription medications, and then there are some lifestyle changes that we can make. So first, I'm going to talk about prescription medications because I am a pharmacist. And then I will talk about some possible ways we can improve our health that can potentially decrease our risk for gout. So first, what medications might help? So medications that might help include things that lower the uric acid level. They're called urate lowering therapies, ULTs. You might see as a acronym for them. So first of all, we have allopurinol, super old drug, works really well, and it's the most common drug. It's fairly inexpensive, but you have to be careful if you have certain genetic issues or kidney or liver problems. We just want to keep the dose safe for you. So be sure to work closely with your doctor to make sure it's safe for whatever complications you might have. A related drug is called febuxostat, and its brand names are Uloric and Adenuric. And that's a great alternative if you can't use allopurinol. And then probenecid is another older drug that's less commonly used now that we have these alternatives. Finally, if nothing else is working for you, they have an IV specialty expensive medication that they can inject called Crystexa or pegloticase. Only problem is it only works about half the time, and it can have severe allergic reactions. So it's pretty much a last ditch resort, but I'm just grateful that such things exist. And then while you're starting these urate lowering therapies, you may need to continue taking colchicine for several months while your uric acid level is lowering, because it takes a while. Uric acid crystals don't just fall apart instantly when we take these drugs. It takes a lot of time. Be sure to follow what your doctor recommends as far as your colchicine or your urate lowering therapies. So I promised you some lifestyle changes that may help to decrease your risk for gout. And these include losing weight. Benjamin Franklin had gout, and he didn't have the luxury of any of these treatments. And back in his day, they called gout a rich man's syndrome. Gout was considered something that only rich people could afford to have because it generally was associated with weight gain, and poor people were generally really malnourished and lower in weight. And it's associated with a higher intake of meat, which generally poor people can't afford, and alcohol intake. So basically, when we act like a poor person, it's potentially a way that we can decrease our risk for gout complications and flares. So losing weight, getting our blood pressure under control, supporting our kidneys, not fasting. Okay, so that would be a poor person thing. We don't want to overeat. That would be a rich person thing, but we also don't want to have prolonged fasting. Either of those are affecting our purine levels. Purine is related to urate. You can kind of hear the ur part in there. We want to keep the amount of food steady. We don't want to overeat, and we don't want to fast too much. We want to just keep it a consistent amount. Consuming excessive amounts of alcohol, particularly beer, whiskey, gin, vodka, rum, and other spirits on a regular basis increases your risk. So not in taking in alcohol is wise when it comes to preventing gout. Consuming large amounts of meat or seafood. So we don't want to do that. Small amounts or minimizing it as much as possible. And then this is something that is prevalent in America for sure, is consuming beverages containing high fructose corn syrup, such as non-diet sodas. So high fructose corn syrup is found in everything from ketchup to Coke. And you just want to check the label and make sure you don't have that in there, because that is increasing your risk for a gout flare and weight gain and diabetes and all sorts of things. So it's best to avoid things that contain high fructose corn syrup. And finally, one possible cause of gout flares is medications that affect the urate levels, such as diuretics. And so this is basically like a drug interaction. Your doctor, talk to your pharmacist, say, hey, am I taking anything that could be worsening my gout? And they can check it out and make sure that everything you're taking is safe for somebody who has gout, because there are alternative medications that you could be taking instead of those. So I'd recommend doing that. And then potential things that could increase your risk for gout include an injury or recent surgery, because it would be releasing things into your blood that might increase your urate levels, fasting, consuming excessive amounts of alcohol, overeating, taking medications that induce a sudden change in your blood urate levels, and dehydration. So that's the final thing that you'd want to do, is stay hydrated with water, preferably not alcohol, not high fructose corn syrup containing beverages. Drinking liquid to avoid dehydration is really important, because basically when there's not enough water in your blood, then those crystals are more concentrated, and that can increase your risk for pain and swelling, inflammation, all of the things. Those are ways you can decrease your risk for gout. And if you have other questions about prednisone, please comment below. And finally, if you find that you are having to take prednisone more than once a year, then I would definitely recommend taking supplements to support you while you're using prednisone, to decrease your risk for side effects, to help you feel like yourself again, instead of having the insomnia, having that trouble sleeping, having weight gain, and the blood sugar changes. You can take supplements to support you. And some of those include melatonin to help with the sleep. You can take chromium to help with the blood sugar changes. Vitamin D and calcium are important to help prevent osteoporosis, especially if you're going to be taking the prednisone for more than 2 weeks. You would want to be supporting yourself with those. So I invented a supplement. I call it Nutrinize Zone. It's the first and only supplement for people on prednisone, and it gives back all of those nutrients you need. Plus, I found other supplement ingredients in here to help counteract other side effects. So you just go to nutrinize.com and you can get it today to help support your body while you're taking prednisone. Signing off as Dr. Megan, your prednisone pharmacist.